All right, party people, we are back at it with a fungal question. Let's get it. If I was to give you a 30-year-old dude from Tibet, that's right, a playa from the Himalayas, he's found to have a cavitary mass in his upper lung. You can see a biopsy at 37 degrees Celsius as well as at 25 degrees Celsius. Based on these findings, what are we thinking about? All right, so looking at these images, you might think, I have no idea what I'm looking at. That's fine. We're going to go through it. But even if this image isn't clear, the vignette that I gave you should be enough to make the diagnosis. So we have a 30-year-old dude from rural Tibet with cavitary mass in the upper lung. This suggests a prior history of TB. Whenever USMLE gives you somebody from a rural area in India, Albania, Tibet, stuff like that, what they're trying to infer is that TB is endemic. So after a successful TB treatment, you might have a residual cavitary lesion where Aspergillus loves to colonize. After the TB has resolved, Aspergillus forms an aspergilloma, aka a fungal ball. Now, USMLE might also tell you, that the patient has HIV or is immunocompromised. But what's most important is the presence of the cavitary lesion. For whatever the reason that they healed it from TB or even a pulmonary abscess, there's a cavity there that is able to be inhabited by this aspergilloma. This is an environment that's very conducive to aspergillus growing. Now, as far as these two images, here on the left, we have a fruiting body at 37 degrees. You have to know this. At 25 degrees Celsius, here you have the 45-degree angle. This is the acute angle septate branching hyphae. This is classic for aspergillus. In contrast, just for reference, the 90 angle branching hyphae suggests mucormycosis, such as mucor, rhizopus, or absidia. Another thing you have to know is allergic bronchopulmonary aspergillosis. This is seen in patients with asthma and hypersensitivity to aspergillus antigen. If they ask about ABPA, it'll be a very straightforward textbook case. You don't have to overthink it. It'll literally be handed to you. You just have to be aware of what the diagnosis is, or you have to be familiar with it at least. Now, in terms of other key facts regarding aspergillus, you have to know. Number one, it colonizes pre-existing cavitary lesions in the lung. It forms aspergillomas. Those are the fungal balls we just mentioned. It can cause ABPA, allergic bronchopulmonary aspergillosis. It's 45-degree branching septate hyphae at 25 degrees, and it has fruiting bodies at 37 degrees. Now, I'll give you some other possible choices that they may have given you on an exam. These are other option choices that I give in conjunction when they're trying to distract you from aspergillus. Absidia and Trospora. Absidia is a species under mucormycosis, along with mucor and rhizopus. These are bead moles and classically infect the paranasal sinuses in immunocompromised diabetic patients. So you have to be familiar with the tropism for glycosylated endothelial cells. If you see 90-degree branching hyphae plus a diabetic with sinus infection, now you're thinking mucormycosis. USMLE won't try to trick you by mixing up fruiting bodies. If they want Absidia, they'll give you the 90-degree hyphae, not 45 degrees. As far as Actinomyces israeli, this is not a fungus. It's a gram-positive filamentous rod. It's also described as beaded filament, as you can see in the image. Two genera of gram-positive filamentous rods you need to know for USMLE are Actinomyces and Nocardia. Actinomyces is anaerobic, not acid-fast. Nocardia is aerobic, weakly acid-fast. Actinomyces can form yellow sulfur granules and cause draining sinus tract, especially in the oral region. You're thinking about oral surgery here. If you're shown confusing images that look like both bacteria and fungus, lots of dots plus filamentous structures, think Actinomyces or Nocardia. The image below is textbook Nocardia. Moving on to Blastomyces. What you have to know for Blastomyces, it's found in wooded areas. The classic descriptor is broad-based budding, and it can also cause disseminated infections. Think lungs, skin, and bone. Now, when I say broad-based budding, I want you looking at this picture over on the right, and you see that purple line separating those two lobules. That's the broad base of the bud that they're referencing. They're easy to spot once you know what you're looking at. Now, when dealing with Candida albicans, what we're looking at here in these two images is pseudohyphae at 25 degrees or single budding yeast at 37 degrees. So on the left, we have the pseudohyphae. These are the buds that are just barely emerging off the main branch. On the right, the single budding yeast is what they're showing you. This is a stylized image just to kind of get you familiar with the concept. Candida will often show green fluorescence. You'll find Candida in patients on broad spectrum antibiotics, parenteral nutrition, or in diabetics. It's also responsible for genital yeast infections. Think of the thick white cottage cheese-like discharge with erythema. As far as Histoplasma capsulatum, this is a very tiny yeast, often smaller than red blood cells. The classic finding is in the area of Ohio/Mississippi River Valley. You want to associate this with bird and bat droppings. So if you have a patient that went recently spelunking or spent a lot of time with pigeons in the park. As far as other oddities that you have to know with histoplasma is that they can disseminate to the adrenals in immunocompromised patients. This can cause an adrenal-like crisis, similar to miliary TB. Now, just a quick rapid-fire review before we wrap things up. Once again, Aspergillus occupies pre-existing lung cavities. For example, those patients who previously recovered from TB. It causes aspergillomas and ABPA. Fruiting bodies take place at 37 degrees Celsius. 45 degree septate hyphae occur at 25 degrees Celsius. Mucormycosis, for example, Epsidia, are 90-degree branching hyphae. They can cause sinus infections in diabetics. For actinomyces, this is a gram-positive filamentous rod, not a fungus. This causes sinus tract infections as well as sulfur granules. As far as blastomyces, you want to think broad-based budding and wooded areas. For candida, we're talking about pseudohyphae at 25 degrees Celsius and budding yeast at 37 degrees Celsius. The risk factors are broad-spectrum antibiotics patients, patients with diabetes, and TPN. Histoplasma is a tiny yeast from bird and bat poop, and it can involve the adrenal glands. All right, that's it for this one. Go crush it.